Hello everyone and welcome to this session. This is session 1 of Module 6. Module 6 focuses on resource allocation in healthcare, and we've been looking specifically at healthcare financing. You have already looked at how the private healthcare sector is structured. This presentation looks at some of the challenges within the private healthcare sector. On slide 1 are session objectives. By the end of this presentation, you will be able to discuss the challenges that the private healthcare sector creates for the delivery of healthcare in South Africa. The question that we prompted you with prior to this presentation is, what are the challenges that private healthcare poses to the public healthcare system? What ideas here come to mind? To answer this question, we have to think about the relationship between private and public healthcare. Even though these seem like two distinct entities, they are linked in many ways. Here is a short recap of health financing more broadly. Remember that a good health financing system raises adequate health funds in a way that ensures people can use needed services and are protected from financial catastrophe or impoverishment associated with having to pay for them. We know that all healthcare, doctors, nurses, drugs, equipment, has to be paid for by someone. The difference here between public and private is who is paying for these services. We also know that there will never be enough money to pay for everything that everyone needs, and all countries have difficulty in providing everyone immediate access to all the services that might maintain or improve their health. As a consequence, the private sector has stepped in to fill a gap where people who can afford additional care can pay for it out of pocket. But you can see already here there is an issue around equity and access. Countries need financing systems that enable people to use all types of health services. This includes promotive services, prevention of disease, treatment for people who are suffering from disease, and rehabilitation. But they need to be able to do this without incurring hardship. If you have to pay huge amounts of your salary towards healthcare, this could influence your life in many different ways. We also know that the National Health Act gives the responsibility of respecting, promoting, and maintaining the health of South Africans to our Minister of Health. And it is his or her responsibility to make sure that people have access to adequate healthcare. This Act establishes a national health system, and the Act encompasses both public and private providers. On slide 4, we look at the relationship between the public and private sector in terms of how funds are raised, and the relationship between the total financing and the population that is covered. In both the public and private sector, money has to be raised in one way or another. In the public sector, it's raised through taxation. In the private sector, it comes from private money. But both forms of financing pool the money together to offer services. Those services are either purchased from a private provider or the government pays for people to deliver those services. However, we see that there is a big disparity between how much money is raised and the population that is covered by that amount of money. So you can see in the first pie chart that the private and the public sector raise about the same amount of money. A significant portion of those funds are paid out of pocket by both people privately. However, when we look at the population, you can see that 68% of the population access the public service. So the same amount of money that is raised is then used for 68% of the population. Whereas for the same amount of money that is raised in the private sector, it only services 16% of the population. So there is a huge discrepancy or disparity between who can afford private health care and the size of the population who is accessing that care. On slide 5, we look at how funds are raised in the private sector. So funds are raised through direct payment from people's private money and not through taxation. And this money is spent in two ways. First of all, people can spend money out of pocket directly. This means that people pay at the point of delivery. We can see that an estimated 19 million rand is spent per year on out-of-pocket expenditure. These are people who are likely to use the public sector primarily, but will still pay privately to consult a doctor or for medication. The other option is through health insurance, which we've discussed previously. The purpose of insurance is to protect people against future health expenditure. It is voluntary, which means people choose to or elect to pay a certain amount of money for different types of insurance schemes. The more you pay, the more you are protected. If you aren't able to do so, you aren't able to prepare yourself for potential future expenditure in the health sector. On slide 6, we ask ourselves, is this a good way to finance health? Let's think about some of the ethical principles you have covered previously. In terms of universal coverage, we can see that this is not really a good solution. This is because there are many things that people will elect not to pay for, even though they might need them, such as immunization or other forms of preventive care. People will choose or make decisions around what they feel is important, and this will usually be made around an illness episode. When we think about financial protection, we see that this is not at all a good solution. The concern is that people will not access care at all because they cannot afford it, or they will access care when it is too late, so they will delay access to care. Worse still, we can see that people might be pushed into poverty by the need to purchase health care. When we think about equity, again, not at all. We see that private healthcare is used by people who can afford it. These are people who already have money. This is usually the segment of the population that is also least likely to need healthcare, yet because they are able to afford it, they do. In terms of efficiency, again, we see not really. This is because people will use what they want and not what they necessarily need. At the same time, we see that healthcare providers will do more than they need to do. In other words, they over-service. A good example here is what is happening currently with the COVID-19 pandemic. We can see that many private healthcare providers are, in fact, losing a lot of their customers. They are not making as much money as they would have done in the same period as last year. This is because people are scared to go into health services or to access health services. What this shows us is that people are likely to use services not because they need to, but because they are able to. We also see that the health sector, the private health sector, over services. In other words, it offers services because they are able to, but not because it's completely necessary. So what is the picture? On slide 7, we look at the relationship between the public and the private sector. If you look at the first graph, we can see that it depicts trends in real per capita spending in the public sector and against medical schemes. So the line at the bottom, in fact, is money that is spent over a 10-year period in the public sector. We can see that there isn't a huge increase in the amounts of funds that has been spent. However, we can see in the line above that the private sector or medical schemes spend more and more money for the same services. Let's look at the second graph. This looks at how the relationship between public and private expenditure on healthcare. Here we can see that the two are intertwined. In fact, we see that the same amount of money is spent between public and private sectors on healthcare. Yet, in the first graph, less money is raised, but the same amount of money is spent. So what this shows us is that the rise in costs in the private sector pushes up the costs of care in the public sector. We know that the public sector services a lot larger proportion of the population, which means we have less money for the same services for a large majority of the population. What are the challenges within the private healthcare sector? We can see that the setting of prices remains unregulated and that there is no ceiling for tariffs. In other words, prices are determined by healthcare providers themselves or by hospitals. If a doctor is renting private rooms within a private hospital, they can determine what their running costs are, and they can then charge what they feel is necessary to offer those services to private patrons. As a result, the Department of Health has stated that the private healthcare sector costs are 5 times those of Europe. We have extremely high costs in our private sector because of the high cost that is determined to run these services. We have to ask ourselves a number of questions. Are high prices a reflection of quality of care in the private sector? The argument is that not necessarily. We don't necessarily offer better care just because we're paying more for it. What about this question? Are these high costs due to lack of competition? You saw earlier on in the session that the Competition Commission found that yes, indeed, the lack of competition means that private sector companies can charge more than they should be. So is the quality of care actually better in the private sector? Well, for one thing, we know that the facilities are definitely a lot better. In fact, they have been described as hotel-like. However, there is still very little information to suggest that the outcomes in the private sector would be any better if the care was delivered in the same way. So finally, we have to ask ourselves, is the private sector viable? First of all, we know that it is unaffordable for the majority of our population. We also know that with rising costs over the past 20 years, the sector is becoming more and more unsustainable. The private sector is also extremely concentrated, and there is little negotiation between the government and the sector itself. Power in the sector remains in the hands of the provider, and patients do not have much of a voice in determining what happens in the sector. We also see that there is limited or no public investment. So as the private sector acknowledges the need to change, what can actually be addressed? First of all, we have to think about how the sector is funded. There are opportunities for lower cost funding opportunities for medical schemes. We also have to ask, how is it organized and delivered? How, in other words, can we make the services more efficient? We have to ask about addressing barriers to market activity. And this was the purpose of the Competition Commission, to say, in actual fact, competition is important within the private sector. And finally, the way in which the private sector makes direct contributions to the public system could be improved. This would improve public investment. For example, we can increase the number of public-private partnerships. So I hope that this session has given you some good ideas in terms of what some of the main challenges are within the private sector.